The most commonly used local anesthetics for dental blockade are lidocaine and bupivacaine or Marcaine. The advantage of bupivacaine is the duration of action is 4 to 6 hours, so it's the best choice for dental blockade. Lidocaine duration is approximately 90 minutes. The downside to bupivacaine is that it can take up to 15 minutes for onset of action, and lidocaine onset is less than 5. So you have two choices when doing the blocks. You can either do the block with bupivacaine far enough in advance that your drug has time for onset before the extraction. So for instance, do the block and then do the cleaning or polishing and go back and do the extraction. Or you can combine lidocaine and bupivacaine in the same syringe for the fast onset of the lidocaine and the long duration of the bupivacaine. The most important thing to remember is to calculate out the total dose that the patient can receive and not exceed that dose no matter how many dental blocks you need to perform. Let's look at some local anesthetic techniques or blocks that we can use to provide analgesia for the pain associated with dentistry and with dental extractions. The first block we're going to look at is the infraorbital block, so called because we block the nerve as it exits the infraorbital foramen. This block provides analgesia for everything cranial to that foramen, so it's a great block to use when removing a canine tooth, and actually also as the drug migrates caudally, anesthetizes all or at least part of the nerves that supply premolar 4 or the carnasial tooth. So a great block to use when you remove that one as well. The second block that we use commonly in the cat is the mandibular block, blocked here at the mandibular foramen. This block desensitizes the entire mandible, so it can be utilized for dentistry anywhere on the mandible. To perform the infraorbital block in the cat, we locate the infraorbital foramen that runs off the rostral margin of premolar 4 or the carnasial tooth and about where the lip and gum intercede. Now this foramen can be really tough to palpate in a cat because they're so small, but that should not deter you from doing this block. You know the nerve is there. So go ahead and block off the rostral margin of premolar 4. And what you're going to see us do here is just insert the needle subgingivally. There's nothing there but gingiva and bone, so nowhere to go wrong. And we're going to insert a little drop of local anesthetic there. You'll see it bleb up right there underneath my finger. What we want to do then is put a finger over that bleb as we withdraw the needle. And what that does is forces the drug back into that foramen, increasing the likelihood that we will desensitize the nerves that supply the premolar 4 or carnasial tooth. Unlike in dogs, we do not want to try to insert the needle into that foramen because the distance from the foramen to the orbit is very small in the cat. The other block that we commonly do in cats is the mandibular block. We want to make sure our dental block is in before we stick our finger in the cat's mouth. We're going to reach way back to the caudal angle of the mandible. In dogs, sometimes you can actually palpate the nerve at the mandibular foramen at the caudal angle of the jaw. Again, in cats, it can be very difficult to palpate because of the size. Shouldn't deter you from doing that block. You know the nerve's there. What we're going to do, though, is keep our finger in the mouth back at the caudal angle, whether or not we can palpate the nerve. Rather than try to block that nerve from the inside of the cat's mouth, though, we're going to come from the outside of the cat. You can block it from the inside, but there's a lot going on in there. Endotracheal tube, a tongue, the mouth gag. So it's much easier to come from the outside of the cat. So I'm going to tip the cat's jaw a little bit. Got my finger on the inside. With my pinky, I'm locating the notch of the mandible. And then I'm actually just going to insert the needle on the lingual side of the mandible, but outside the cat. I'm using my finger inside the mouth to make sure that that needle stays between the gingiva and the bone. We know that's where the nerve is. It won't do us much good if we inject our local anesthetic into the mouth. So now I'm going to actually easily inject until I can feel a bleb underneath my finger. For both of these blocks, it's about 1/10 of a mil or less. Again, staying below the total dose that you calculated for the cat. To block the palate, we block the palatine nerve as it comes out of the palatine fossa. We can locate that because it's in an area just proximal to the premolar 4 or carnasial tooth in the cat. This isn't a fossa that you can actually palpate or a fossa that you can insert the needle into, so we just want to find the general region, get the needle sub-gingiva, and inject a little bit of local anesthetic.